Upon completing this in-service, you will number 1, understand the departmental risk of exposure to infectious materials. Number 2, understand the difference between standard and isolation precautions. And number 3, know the protocol for isolation precautions during meal service. Dietary employees may be exposed to respiratory hazards, blood, or other potentially infectious material if they are required to take dietary trays to patients in isolation rooms. Exposure to infectious materials may also occur when handling red badge contaminated food trays that have come from isolation rooms to the kitchen to be sterilized. Understanding isolation precautions. Standard precautions are the minimum infection prevention practices that should be used in the care of all residents all of the time. These practices are designed to both protect the healthcare worker and to prevent the healthcare worker from spreading infections among residents and include hand hygiene, use of personal protective equipment such as gloves, gowns, and masks, safe handling of potentially contaminated equipment or surfaces in the patient environment, and respiratory hygiene, cough etiquette. Isolation precautions are used to help stop the spread of germs from one person to another. These precautions protect residents, families, visitors, and healthcare workers from the spread of germs. Generally, when someone is placed on isolation precautions, there is a sign at the door to remind visitors and healthcare workers which isolation precautions are needed. All healthcare workers and visitors need to follow these guidelines. Healthcare workers should not eat or drink in isolation rooms and should always clean their hands before entering the room and upon exiting the room. Following isolation precautions during meal service. Meals, dishes, and utensils should be handled properly to prevent contamination. Universal precautions may be followed. Nursing should notify the kitchen when an isolation meal is needed. They can specify whether disposable dishes, utensils, and single-service items are needed. The isolation meal should be delivered to the appropriate staff to assure the meal reaches the appropriate patient or resident. The isolation meal tray will be returned back to the kitchen to be handled with standard precautions, apron, single-use gloves, and dish machine temperature is appropriate for destroying bacteria and microorganisms. For individuals needing disposable items, only single-use items will enter the isolation room. If a tray is used to carry the food items to the isolation room, unless disposable, the tray itself will not enter the room. All leftover food, dishes, and utensils will be disposed of in the isolation room as defined by nursing isolation techniques. No leftover food, dishes, or utensils are to be returned to the kitchen. If staff come in contact with blood or other potentially infectious material, or if they are stuck by a needle or sharp, the supervisor must be informed to seek appropriate medical treatment. Let's test your knowledge. Isolation precautions in the food service department. Question number 1. Exposure to infectious materials may occur when A. Handling raw chicken with bare hands, B. Handling red badge contaminated food trays, C. Taking dietary trays to patients in isolation rooms, or D. Both B and C. And the answer to question number 1, exposure to infectious materials may occur when? The answer is D, both B and C. Question number 2, which of the following is a protective barrier for standard precautions? A. Mask, B. Gloves, C. Gown, or D. All of the above? And the answer to question number 2, which of the following is a protective barrier for standard precautions? The answer is D. All of the above. Question number 3. Isolation precautions are used to A. Prevent residents from socializing with one another, B. Allow staff to come to work when ill, C. Help stop the spread of germs, or D. None of the above. And the answer to question number 3, isolation precautions are used to C, help stop the spread of germs. Question number 4, true or false? Hand hygiene is not important when dealing with patients with isolation precautions. And the answer to question number 4 is false. Hand hygiene is extremely important when dealing with patients with isolation precautions. Question number 5, true or false? Disposable items must be used for all isolation precautions. And the answer to question number 5 is false. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information about our in-service training programs or consulting dietitian services, please contact us at 1-800-761-9200 or nutritioncaresystems.com.